Hi, everyone. Dr. Marla Payne Thurman here. I'm representing the U.S. Autism Association with our guest speaker today, Kara Darling, who is the clinical administrator for Lighthouse Complex Care Centers. And there's multiples of those, correct, Kara? There's how many? Do you have two or three?
We have two right now.
Two
One,
centers.
one in Denver and one in Wilmington, Delaware.
So thank you for being with us. We're going to talk about a bunch of kind of really in-depth um, kind of integrative medicine stuff and get into kind of the comorbidity stuff and some of the physiology of autism today, which is a topic we don't get to do very often. So we're excited to that. So, Kara, start by telling me a little bit about yourself, and then I want you to tell me a little bit about your businesses.
Sure, absolutely. So my interest in autism began a lot, like many of us, with a child who was diagnosed with autism. My son, who is now 17, was diagnosed with autism when he was 4. And he had a pretty severe regressive autism case. And at the time, my background, I have a degree in like medical anthropology. So I've looked at like healthcare in different systems and how people view, wellness and disease and, physiology, germ theory, those kind of things. And then after I graduated, I went and I studied midwifery and I did maternal child healthcare. And so my son was my third child. I considered myself sort of a pretty experienced parent at that point. I was
Then all of a
completely.
sudden,
Yes, all of a sudden, I was completely. I remember I lived in rural Arkansas at the time, and I would drive by this billboard, and it had this statistic on the billboard that, like, I think at the time it was like 1 in 129
yeah.
children are diagnosed with autism every day. And I remember driving by that billboard and barely paying any attention to it. And then when my son regressed and was diagnosed, I thought, man, I didn't understand what that billboard was saying.
Right, right.
And so at the time that he was diagnosed, I was working as a midwife. I was, licensed, and I attended birth center births and actually did some home births at the time. And I also was a medical interpreter. And so when he was diagnosed, it became sort of a personal mission, like so many of us, to do sort of a deep dive
Exactly. Yeah.
into what's going on in his body, why. And he had a very abrupt onset. It was like within a period of 3 weeks. I can tell you exactly the 3 week period from when he went from a precocious child who could ride his bike without training wheels at 3.5 and was reading like consonant vowel consonant words and was like developing typically, to regressing into his own world, losing functional language, self-harming. He actually had some hallucinations. He had like all of these different symptomology.
Mm.
And at the time, I just couldn't believe, like with my medical background, I couldn't believe that he had lost the like the
Yeah.
physiological ability to be in a state of wellness and interact with us. And so thus began my my sort of autism quest and journey. And it turns out for my son, he has about 6 different autoimmune conditions that have clustered, and the intersection of his immunology and his neurology, what causes neuroinflammatory processes in his brain, that then sort of expresses as autism and
Right.
autistic traits. And so it took me a few years to sort of really delve in and get him to a point where I felt like that I could help others. And it actually began by some of his medical providers looking and saying, "Oh, Kara, what are you doing with, your son?
Right.
That
Right.
he had this problem before, and now he doesn't have this problem, and so, I have this, I have other patients that have these problems. Can you tell me, what it did, or can I put you in touch with this other, family, and can you help them?" And then it just sort of grew from there. And so I ended up doing certifying. We moved to Colorado in the whole interim,
Sure.
mostly to access healthcare for him. And I ended up certifying as a patient navigator. And so I specialized in neuroimmune conditions as a patient navigator. It basically just helped people access care, determine what kind of care they needed, track their things. And
Mhm.
then while all of that was going on, I was talking with some other parents one day and about why you even needed patient navigators in
Right.
our healthcare system. And we said, you know what? We really would love to have, a clinic or a medical center where you could go and the patient navigation piece is sort of built in, and
Okay.
people are looking holistically at all of the patient's symptoms, and then trying to figure out etiologies for those comorbidities or the healthcare issues that we
Mhm.
have. And
Right.
that's how Lighthouse was born.
That's
um,
awesome.
yeah, we wanted to build something that would be supportive of families, and also be more integrative, more holistic in the way that we looked at patients and how we help those patients, come back to wellness or achieve
Mhm.
wellness.
That's great. So for just a minute, let's do some terminology because we have in our field, we have biomedical, we have functional, we have naturopathy, we have integrative medicine. So define for me what integrative medicine actually is for people who might not know that.
Okay, and again, you're right. The terminology, people even use it in different ways, so there's no
Right.
like one right way. But for us, what it means at Lighthouse or for me is we want every tool in the toolbox to help a complicated patient. And most of our patients, particularly people with autism, they have complicated health issues because
Right.
they have these intersective issues. Their gastrointestinal issues, their immunological issues, their neurological issues, all of these comorbidities that people with autism are more likely to express require cross-system interaction. And so when we say integrative, we mean we will pull stuff from allopathic or more traditional medicine or
Mhm.
from functional medicine. We truly want to cross that aisle and be both functional and allopathic according to the personalized medicine profile of the patient. And
Right.
so that's what integrative means to us. It
Mhm.
means that we are not going to be opposed to, getting imaging or having a surgery or using a prescription med when it's indicated. We're also not going to be opposed to using herbs or supplements, really trying to delve into diet and the other, holistic supportive ways that are more traditionally functional medicine. And we
Yeah.
try to sort of bring that into an overarching personalized plan for the patients in our clinics.
That's awesome. All right, so let's take just another little short detour and talk about kind of we have this argument in the world like, are we curing autism or are we treating autism? Or so tell me a little about your thoughts on that because the autistic community, the high functioning autistic community is saying, wait a minute, we don't want to be cured. We don't want to be treated. You don't have the right to do that.
Mhm.
Whereas the families who have these really severe, very sick kids who are not able to independently take care of themselves. They're saying, wait a minute, we want to be in the physical, mental, medical community because we need those kinds of support. So, talk to me about that for just a minute.
Absolutely. So obviously, we want to celebrate neurodiversity. My household is very neurodiverse, and we actually do enjoy that aspect of ourselves. And we would not want to, minimize or just disparage anybody's neurodiversity. What we say at Lighthouse is we are not treating autism or curing autism. We are treating the medical comorbidities. we
Right.
we know that people with autism have certain predispositions to certain medical problems, and we want to make sure that all of the systems have been checked, all of the results have not been ignored,
Right.
and that everybody has their best chance at wellness and living that life to their fullest potential. And so it's not so much about treating or curing autism. It's more about making sure that every person has the right, even a person who is diagnosed with autism, to adequate medical diagnosis and treatment. Because we see so many times, Marlo, where there's a true medical condition and it
Yeah.
gets dismissed or blown off because, oh, that's just people with autism, they're just constipated, or people with autism, they just have seizures. So we're not going to treat that. We're not going to offer an anti-epileptic, or we're not going to try to regulate their bowels. And we feel like that's really a disservice because we're all Homo sapiens, and so we all benefit benefit from our bodies functioning normally, according to our physiological processes. So we don't want to ignore these kinds of things that are real problems for quality of life for anybody, whether you're autistic or not.
Right. And I think I'll jump in for just a minute. I have training as a naturopath, doctoral level training as a naturopath. I don't work as a naturopath, but I use that to inform my care. And this idea that, that sometimes that medical physiology gets ignored because of the autism, that's really common. And I'll jump in and tell a quick story. I had a kid that I was seeing for he basically had obstructed bowel and had to be irrigated pretty regularly and was constipated all the time and just had this terrible issue with eliminating his bowel. And he was sent to me for because of his fear of pooping. And the reality is the kid's afraid of pooping because it hurts. I mean,
Right.
it's not that he had an innate autistic fear of defecation. He actually was in a lot of pain, and so over time that had become a fear. But it was just so interesting to me that this child goes into this medical doctor who really is like, well, we've cleared out your bowels several times. You need to go see a psychologist and learn how to not be afraid of going to the toilet, and then that'll cure you. And I'm like, hello. I mean, it
Yeah,
was just insane to me.
quite honestly, we find it infuriating. I
Yeah,
mean, like it's common knowledge. It's been common knowledge for forever that if you have, epileptic activity in your brain, then that can cause brain injury. It can cause,
really.
cognitive issues. It can cause you can have an acquired brain
Memory,
injury
executive
from.
functioning, those things
Yes,
that we see.
exactly. And
Yeah.
so to ignore that and not offer like standard treatment, a lot of times we teach our parents when they go in to see specialists, because we do care coordination with the specialists, to ask their doctors or their other healthcare providers, if my child weren't autistic, or
Well,
if
how
for a
would you
verbal person,
yeah,
if
exactly.
I'm
What
not
would you do
autistic,
if this
how would
wasn't
you treat
autism?
that? And
Um,
usually the provider will cock their eyebrow and say, oh, well, I would do X, Y, or Z. They know
okay, then
exactly what
let's
they
do
would do.
that.
Yes, and that's exactly what we say. We say, okay, well, then, yeah, can we please have access to the same kind of care? And
Yeah.
then if they say, oh, no, because he or she is autistic, and, we're not going to do that, then we say, well, would you please document in the chart that you're refusing to treat that abnormal EEG? We'd like that documented just so that we know for sure we
Have
can
a
track
paper
it.
trail on
Yes,
that.
exactly.
Exactly.
And
Yeah.
how, 9 times out of 10, I mean, obviously very respectfully, very nicely, they'll decide to do a trial of a medication, or they'll decide that that medical issue might actually be a medical issue, and maybe they do need to order that imaging, or they do need to follow the standard of care that they would with any neurotypical person. And
Yeah.
that's sort of one of the battles that we've sort of, taken up is
Good for
making
you,
sure
because it needs
that
to be done.
everybody gets equal access to care, equal access to treatment, again, to get people to their best, baseline wellness.
Exactly. Okay, so let's jump in. What are some of the comorbidities you see? What are the more common ones? And again, it can be different for every kid, right? But and there's as many different kids as there are conditions with autism. But let's talk about the trends that you tend to see in your clinics.
Absolutely. Well, obviously, a big one is GI complaints. Over
Uh-huh.
90% of people with autism have some kind of GI complaint, whether
Mhm.
it's irritable bowel or constipation, or, celiac disease, or, some other kinds of, reflux, dietary issue. Like 90% of people with autism will have a problem with their digestive system. So, gastrointestinal issues,
Uh-huh.
and they are treatable. There are things that we can do to help people with their gastrointestinal comorbidities. And honestly, a lot of behavioral manifestations can come from GI pain, or I mean, I'm sorry, anybody who can't poop is going to be irritable, and things are going to hurt more,
Yeah.
or anybody who has chronic diarrhea, when you don't feel good, then it's really hard to keep that, facade on of, niceties, or, keep yourself in a very interactive mode. And so taking that away helps people be able to, go about and do the things that they want to
Right.
do in their ADLs, or even in their achieving their goals. So So GI is a big one. Seizures, about 30 to 40% of people with autism do have seizures or abnormal EEGs and that kind of activity. And that I would sort of throw almost like migraine headaches and those kind of things
Well, and
in.
there's multiple kinds of seizures too. Take a minute and
Right.
explain that, because you don't have to have the grand mal on the ground seizure to be having seizure activity. So tell us just a quick
Yeah,
minute about
correct. Yeah, some people, and some people don't even have full blown seizures. They have what are called like epileptiform spikes, or they just have. A lot of times when you're asleep, you may not even know
that.
because people are sleeping and they have this abnormal activity in their brains. So and it could be as simple as staring into space or a flutter of an eyelid, and they can also be really short. They don't have to be these long. Some people do have the whole tonic clonic grand mal, whatever it is, but other people will have multiple just seconds. But all of those things need to be taken into consideration for people with autism. And then there's immune deficiencies like CVID, common variable immunodeficiency. 20 to 30% of people with autism have immune deficiencies that make them more susceptible to infections. And then as they get infections, that sort of revs their immune system. And so then that turns into some either autoinflammatory or even kind of autoimmune kinds of conditions with overactivation of their immune system. So immune irregularities are definitely another big one. So GI problems, immune irregularities, the seizure kind of activity, and then basically neurologically, there's something called encephalopathy, which is basically brain inflammation, and that can have a variety of causes. You can have encephalopathy from metabolic issues. You can have it post-infectiously. You can have it from issues with your immune system, and so a large percentage of people with autism will have some sort of neurological inflammation or encephalopathy, and that's where a lot of the sensory issues can come from. And stimming is another big one that can also happen when you have a lot of neurological inflammation. And so those are the things that we sort of target in our clinic as we look through people's, medical records, and then we start our diagnostic investigations, and we're trying to help people figure out, how to live their best life.
Right. Okay, so before we dive into that, I want, and this is going to be something we didn't talk about ahead of time, but why? Why do individuals with autism, why are they more susceptible? Why do they have these things? Do you have a personal gut kind of response to that?
Yes, of course, I have a personal theory.
Let's hear it. 'Cause I'm interested.
um, so there's a system in our bodies, and it's called methylation, and it's a system of enzymes that basically both build and break down signaling chemicals, all the signaling chemicals. So hormones, neurotransmitters, which are a specialized kind of hormone, your immune system signals, both your innate and acquired. All of this is basically part of the system of enzymes.
Right.
And it also is the way that your body rids itself of waste. It's your detoxification system is included in the methylation system, and it actually is feeds or is part of your mitochondrial function, which is your body's basic energy function.
Right.
So the basis of this system is basically folate processing. And if you look correlatory to when the autism diagnosis sort of exploded, it was about the time the March of Dimes introduced supplemental folate to pregnant women. And so before, women who were pregnant who had problems with methylation had a very high rate of miscarriage.
Right.
And then we started supplementing all of our pregnancies with
Folate.
with folate, and now all of a sudden we had women carrying pregnancies to term that otherwise would not have been viable pregnancies. And then we saw this increase in autism diagnoses, as genetically people with methylation defects were born and able to grow and function. So it was a double-edged sword in that these enzymatic problems we're fixed on the one hand, but then on the other hand, we see the deficits caused by that kind of. And one thing that you can really look at, and that is another a thing that's sort of prevalent again with people with autism, is you look for midline defects. Tongue tie, which affects your autonomic nervous system, your vagus nerve, and that fight or flight or rest and digest kind of switch that we have. Deviated septums. So a lot of we'll have patients who have like immune deficiency, and then they can't clear their sinus well because they had a tongue tie that gave them a very high arched palate and a deviated septum, and now all of a sudden we have neuroinflammation coming from chronic illness in the sinuses, and we can get that drained out, cleared, that treated, and all of a sudden they feel a lot better, and they have a lot less symptomatic presentation because of that. But it all goes back to, again, this system of enzymes that's sort of based on folate processing. Now, again, obviously that's
And
just
again,
one theory.
that's your opinion and not necessarily the opinion of the US Autism Association. But I'm always interested in asking that question because I think we all have kind of some different things that we see from our little corner. And there's probably some truth to all of these pieces, right?
Yeah,
Let's
and again, that is my personal opinion too. That's not necessarily in the official stance of Lighthouse or whatever. And of course, there's all sorts of other like theories about toxicity or exposure to chemicals, or like there's all sorts of reasons why. Or is it overdiagnoses? Is it just we can recognize
and I
autism?
would disagree with that one. But
Right?
there's
Yeah,
just too many sick kids. Yeah. Um,
exactly.
I think we can all agree, though, that there's something affecting the methylation process, right? In other words, that if there is a methylation process that is turning up and turning down certain volume regulators that then contribute to certain behaviors. The other thing I think we can all agree to is that gut brain upregulation downregulation is really out of balance in autism. We know that, and so when we understand that so much of our neurochemistry in our brain actually is comes from our gut, that when we think about so many of, I mean, almost all individuals on the spectrum have had some gut stuff going on at different periods in their life. And so thinking about that piece, I think that's another piece that we can really agree upon. So let's talk about then, we've kind of talked about the comorbidities. So now let's get into the kind of how you prioritize, how you sort through all this stuff, because we're talking about 10 or 15 different systems here, and you're trying to integrate those in a way that makes sense and that you can prioritize and actually work towards some kind of a treatment plan. Let's go there. I think I think that'd be
Absolutely.
helpful for us.
And I brought my little handy dandy visual graphic. So if you'll permit me to share my screen,
Yes, go ahead.
then
Let's go.
I
Feel free
will.
to share.
Sure. Okay. Then I will talk us through the way that we at Lighthouse have found most helpful to, not get lost in
That
this,
sounds great.
process. I don't know. Is the captioning for you, over the graphic,
Yeah.
or?
We're seeing it. Yeah, it's lined up right.
Okay, great. So basically, at Lighthouse, we call this the pyramid, and you've probably seen this pyramid in other graphics for other things, but we've taken it and adapted it to our system of biochemical investigation that leads to a personalized medicine treatment plan for everybody in our clinic. And in all fairness, we don't just do this for autism; we do this for other kinds of conditions
Right.
as well. But we do have a personal interest and a very large cohort of patients that have autism that we apply this to. And so this is just a scaffold. The treatment plans and the information that come out of this pyramid are going to be different for every individual. So what we prioritize for you won't necessarily be the same thing that we would prioritize for me, because it's all based on your own data, your own laboratory results, your own symptoms, your personal kind of your personalized data. But the way we've found to approach things, when we're treating something that is as multisystemic as autism, that we're talking about gastro, neuro, immunology, basically,
Right.
and then some genetics thrown in, right?
Right.
um, that what we've found is that we have to be very, very cognizant of precursors and products. What comes first? What comes next? Where do the processes sort of start in etiology? And as you mentioned a minute ago, a lot of it does start with our gut, or the building blocks of everything in our body, from our signaling chemicals to our structural self. All of that has to come into our body through the foods that we eat. And then,
Right.
so not only is it the building blocks of all the things that we need, it's also the energy to actually build the little batteries that
Right.
run all of our processes. And so we always start with investigations of diet and investigations of gut and microbiome. And as you mentioned before, 80% of your serotonin is produced by your microbiome. Digestion and microbiome go hand in hand. Our mitochondrial function, actually, mitochondria used to be evolutionarily, they used to be their own little bacteria until there was a symbiotic relationship with eukaryotic cells. And so there are cousins of our little mitochondria in our cells, in our gut, that still talk to them through chemical signaling and
Right.
tell them, make more energy or slow down. And so all of that, we have more buddies in our gut than we have human cells in our body, is one of the sort of tidbits that people like to reference. And so all of that, it makes it very important for us to look and see, what does that microbiome look like? How well are we digesting our food? How well are we absorbing those nutrients? Are there inflammatory things that we're eating or doing to our GI tract that are making it where we can absorb our nutrients? Do we have the constipation or the irritable bowel or the celiac issues or all of those kind of things? And so after we look at that, then we're going to move on to the nutrient deficiencies. And why wouldn't we start with nutrient deficiencies? Well, because we can give you a Band-Aid and we can try to supply you with the nutrients. But if I'm giving you a nutrient orally, and then how are
The
you going
gut's
to,
not working. Right.
the gut won't absorb it, then I'm not going to correct your deficiency, right? And so we have to get that absorbed. We tell people, you know what, you might as well take that big, nice, expensive bottle of vitamins and just dump it in the
Dump it in the
toilet,
toilet because that's where it's going.
because that's where it's going, exactly. So after we're sure that food absorption is happening, nutrient absorption is happening, that our microbiome is in a better place, then we're going to move on and check those nutrient deficiencies, because sometimes they're actually metabolic processes that cause deficiencies versus actually having a deficiency of it coming
Absorb.
in. So
Yeah. Mhm.
um and then specifically we break out B12 and folate on their own because of the methylation system, because they are the sort of the primary functional building blocks for that system of enzymes. That whole system of enzymes works like little cycles. I liken it to like gears on a clock. And like B12 is sort of the center gear, and if it's stuck, nothing else will turn. And
Right.
so making sure that we have adequate folate processing going on. And there's some autoimmune conditions that will affect that we check for, to make sure that that key piece is in place. Once we've checked there, we can look at mitochondrial function. Why can't we just jump in and grab mitofunction from the beginning? We know that a lot of people with autism have problems with mitochondria. Why don't we just start there? Well, again, if the nutrients aren't going in, the Krebs cycle will not spin, because you have to have your fats, your carbohydrates, and your proteins converted to that, acetyl-CoA to run your Krebs cycle, and that comes from food. So we don't want to jump in and try to push mitochondrial function until we're sure we're getting those nutrients. And then mitochondrial function won't work without folate. And so we have to correct that process before then we have the energy in our cells and in our bodies to run our processes. And lack of energy causes a lot of immune dysfunction. Number
Right.
one user of energy in our body is our nervous system, our brain and our nervous system. Number two system is our immune system. So when
Right.
we have a deficit of energy in our bodies, then we can get that imbalance where we have some deficiencies and some overactivities in our immune system. So we want to correct that first before we get into heavy immunomodulation.
Right. Right.
At some point, sometimes this is all people need. Sometimes we can go through and we can help with their gut, their nutrient deficiencies, give them a little mitochondrial help, and all of a sudden they can fight off infections. All of a
Right.
sudden their nervous system will calm down. Then that immune system balance will come back into balance, and they don't need further modulation. Other people do. Other people maybe have some sort of chronic infection that has taken hold, or some sort of ongoing environmental influence. We know that like mycotoxins from mold exposure are very immune suppressive and inflammatory at the same time. Obviously there's other things in the environment that can, cause an inflammatory response. There's chronic infections. And if we're talking about, again, a comorbidity being that we have trouble fighting stuff off, and then as I'm shunting all of my energy to fighting a pathogen, then I don't have, the energy to turn off inflammatory processes, or I don't have the energy to run other systems in my body. So we'll work through systematically looking at mitochondria and then things in the environment and infectious influences, and then we tackle immune balance, because
Right.
again, if I have a chronic infection, it's going to be really hard for me to get immune balance until I
Yeah.
get rid of that pathogen that's irritating my immune system. And I can't balance my immune system until my mitochondria have given me the energy to run all the moving parts. And so
Yeah.
as after we've come this far in like our diagnostic approach, this is a scaffold, this is an outline. Sometimes we may still be stumped. That's when we're going to go out hard and heavy after the genetics, the whole exome sequencing. We're going to look at genetic panels. We're going to see, and when we say genetics, we don't mean, oh, you have this mutation, welcome to your new baseline, have a nice life. We
Yeah.
mean, let's look and see if there's a problem with a particular protein. What is the function of that protein? Does it make an enzyme? Can we supplement the product of that enzyme? Can we push the precursors? There are still things that you can do even with genetic conditions to help people have a better baseline and have more wellness in their life. And
Right.
so a lot of people want to just say, oh, that's genetic, I'm sorry, and that's really not the way we look at it. We look at it as more information about the biochemical processes in the body. And we've gotten some really neat hits. We've found some really interesting things where we've had a lot of our older individuals with autism. I'm thinking particularly we had a young man in our clinic who was about 20, and he had a particular phospholipid deficiency that we found genetically. We were able to supplement that orally, and all of a sudden his quality of life went boom. He went from not being able to perform ADLs, not being able really to adequately communicate, to holding a part-time job and interacting with his family, and like it can make a really big difference. And so once we've gotten to the point where we have our systems in balance, then we're going for neurological reorganization. And Marla, this is really interesting because when you get a diagnosis of autism and you
Yeah.
go, your pediatrician or your family doctor says, okay, well, your child has autism. What is the first thing they give you? They don't give you a slip for lab work. They don't give you a thing for, an order
They
for a
try to treat your
24-hour EEG.
anxiety.
Yeah, well, they give
What?
you
Yeah.
speech, OT, and maybe
Behavior
ABA.
therapy. Yeah,
Yes,
ABA.
ABA, right?
And
All
a
of that is,
medication. Yeah, Resperdal or
mm,
an SSRI, right?
yeah, possibly. Actually, I would argue that you're probably lucky if you get any medication at all, because that's not normally what people do. They say
If
go
your
to speech.
behavior's bad, then
Yeah,
that's what you
right, exactly. And they say go to speech, go to OT, and go to ABA, and all of that is neurological reorganization, and
yeah.
it's really hard to lead. That leans on neuroplasticity. That leans on the ability of the brain to reform those, neurological pathways through neurotransmitter creation, right? Through to learn a new behavior or to act in a different way. And if you've got brain inflammation, you've got problems with your signaling chemicals. Your methylation system doesn't have what it needs to make those neurotransmitters to set those pathways. It
Hmm.
is really, really hard. You will make very eking progress in your neurological reorganization. And that's the first thing as a society we hand to people that are newly diagnosed. And really, we should be giving them a lab slip and an EEG order, and we should be like looking at their microbiome. But instead, we're saying, go take yourself over here
Time
and
and
try to
money.
lean on this process that your brain's not ready for. And I really love to tell the story of this with my son. So my son, when he was first diagnosed, he had all the evaluations, and he was 4, and he had the fine motor skills of a 9-month-old. He was less than first percentile with his fine motor skills. So we go trotting like, good little people over to OT to work on his fine motor skills. And we work and we work. And, we're in there for a few years, and he's still first percentile. Like, he's making little pieces of progress, but he's not really making it. And about that time, we figured out his autoimmune conditions. And so we actually stopped OT for a while, and we did some IVIG, and we did some, other kinds of things with his immune system. And then he actually got to a pretty good baseline, and we came back to OT when he was about 10. And they assessed him, and he was still at the first percentile. His fine motor still wasn't great. 6 months later in OT, he was graduating. He was 80th percentile, and they were discharging him because that 6 months, his brain was now ready. His neurological inflammation was out of the way, and his signaling chemicals were working, so he could reset those pathways. So it wasn't that he didn't need OT, it's that we were giving him OT at the wrong time when it was really hard for that to make a difference. And by taking away the medical comorbidities, the medical impediments to his fine motor skills, calming his nervous system down, he achieved in 6 months what he couldn't achieve in years.
Yeah.
And so that's a pretty classic example of how neurological reorganization should be at the top of the pyramid. You should be, in a state where now you're ready for that, beautiful brain remodeling to happen versus trying to force it on, a physiology that's not ready. And then down the sides, you see our inflammation and our detoxification. We are continually aware that people with autism have glutathione deficiencies. They have problems with sulfur processing. Again, that's that enzymatic pathway in the methylation cycle that's responsible for detoxification. So we're continually supporting there. And then we're also continually aware of these inflammatory processes. And even as we modulate the gut and we kill the bacteria, the bad bacteria that shouldn't be there, that can cause inflammation with the die-off or the Herxheimer reaction. And so as we work through these things, as we support mitochondrial function, when you upregulate your mitochondria, you cause oxidative stress, which can be inflammatory. So you have to make sure you have those antioxidants on board. So we're continually modulating the inflammatory processes and the detoxification as we work through our scaffolding. I think we talked a little bit before. Part of the diagnostic approach, though, is it's not just about all the testing that we do for people. It's about making sure we comb through those records when they come to us, and we identify all of those abnormalities that are in the records and brushed off, by
Which is common.
traditional practitioners, like we've said before. We may come in and we may see B12 levels of 200, and that's right in the reference range, so nobody cares, and nobody but in the literature, if your B12 level is less than 400, then statistically you're going to have neuropsychiatric effects. Your B12 level needs to be much higher than that. And so that careful records review is another thing that's really important when we're trying to figure out and unravel all of these systems in a complex, a neuroimmune condition.
Right. And by the way, and let's put right at the very top of this, then go to school and be nice to your friends, right?
Right. That's that old adage, it's sort of hard to sit
It's like
still
if
when
you,
you're sitting on a tack. You've seen that? It's hard to sit still if you're sitting on a tack. And
yeah.
then And then the corollary is if you're sitting on two tacks, removing one of them isn't
It's
necessarily
not gonna
50%
make you feel
improvement.
better.
Yes, you still have a tack down there,
Yeah,
right?
exactly.
It's
Yeah.
completely unreasonable to send somebody with real medical issues into school and ask them to learn,
Yeah.
or into these other social situations where already we have to, there's so many things to keep track of pragmatically. There's so many things that we have to do, and then if I don't feel well, and we're asking impossible task, and so then we want to squeeze people into these boxes with some sort of harsh tools that I don't really think are appropriate. If we could just allow people's physiology to be supported, then we could have a lot more success, and people could participate as they desire in our society and our organizations and their community.
Yeah. Okay, so let's go through and not maybe every single level, but for a family who, doesn't have the resources or is not able to show up at your door, what are some of the pieces that they could actually be looking at for their own kids at some of these different levels? Where, and again, yeah, it's great. Let's go to Lighthouse and let's get all this done and let's have a master team in charge of all this. But that's not a reality for all parents, right? So let's talk about kind of
Yeah,
some
well,
of the players that you have along the way.
we can certainly do that, but let's also point out that we are Medicaid and Medicare acceptors. We accept all
Right.
commercial payers. Many clinics that do have this kind of integrative approach do not, and so that's another thing that we have been really, really dedicated to is accessibility. Because again, we
Uh,
want everybody to be able to get adequate medical care. But if somebody, for some reason, at this point, a lot of it sometimes it can just be overwhelmed. Maybe
yeah.
you are financially challenged, but you have Medicaid. You could come and do some of these things, but it's just day-to-day life is all that you have in you right now. And
Yeah.
so starting another treatment plan or another medical provider is just daunting. And so obviously it's if you look at the bottom of our pyramid, I mean, diet is something that you can modify pretty easily on your own, without a lot of extra expense. Now the
And
issue is
where would you
again.
go with that? What are the priorities that you would say a parent should start with in terms of dietary modification?
So again, we believe that diet is as specific as the individual, but everybody benefits from whole foods. Everybody benefits from eliminating, artificial ingredients, preservatives, sweeteners, food dyes, all of those things, just as human beings. They're just not really good for us. So starting with making sure that we always say, give it the window test. If you can look out the window and see it growing or see it moving, or whatever, then that's a
Then you
really
can
good
eat
thing to put
it.
in your body. But you
Right.
can't see a cookie growing on a stem outside. So probably that's processed, and that's some of the stuff that you should be limiting in your body.
Right.
And so everybody can start with that. Now, whether or not you need to be, statistically, the diet that has the most success with autistic individuals is the gluten and casein free diet, but that's not necessary for everybody. And so we do like testing. But again, say maybe, you're overwhelmed with testing, or some of the testing can be specialty testing. That's an increased expense. Maybe you don't have insurance. You can do an elimination of those two, major irritants and see if you notice any difference. Now, the caveat is your elimination diet of gluten needs to be at least 3 months long, because that's how long it takes for a human being to clear those antibodies out. And it has to be very strict. If you get even, a couple of bites of an infraction, the clock starts over again. So you might be a month in, but then you eat a piece of birthday cake, and then all of a sudden you need three more months. So most people opt for some testing instead of doing the strict trial and elimination, but that is an option. And those are the two biggest offenders. But again, everybody is different. There's so many diets out there. If you look at, diets that are really biochemically based, there's the GAPS diet, there's the low oxalate, there's the salicylate and phenols, or the Feingold diet. You have your keto diet for seizure. And so that's sort of where we come in to kind of help you like test and sort through because we want you to be able to eat the widest variety of foods possible,
Right. Right.
without causing an inflammatory response in the body. But everybody will benefit from whole foods eliminating, lots of extra sugar and extra preservatives and ingredients in their diet. And you can see, I mean, the red food dye kids are real obvious, you know.
Oh yeah.
Um,
And I heard somewhere, and maybe you can comment on this, that kids, like if you list the like on a picky eater who only has 10 foods they eat, if you look at that list of 10, their food sensitivities are on that list because of the inflammatory response that gives them kind of that feel good neurochemical when they get when they're reacting to those foods that actually kind of feels good neurochemically. Have you heard that, or do you guys support
well,
that?
well, again, it's going to depend on exactly which one you're talking about. But
Right.
what I think you're referring to is something we call the white diet. And the white diet, I'm going to take this off the screen again so we can just talk. The white diet is basically, we see these kids and they like to eat white bread, chicken nuggets, cheese pizza, and milk. Sometimes it's chocolate milk. And that is because particularly
Macaroni and
gluten.
cheese has to be on that
Oh,
list.
macaroni and cheese. You're right. That's another one. Yes. And that is because particularly, gluten and casein, when they're partially digested, when your body cannot break them down properly, those partially digested protein pieces are opioids. They mimic opioids in your
Right.
body.
That's what I was, yeah.
Yes, and
Yeah.
they're addicting. Every food doesn't do that, but particularly gluten and casein. The kids on the white diet and the parents will come in and they'll say, well, then they won't eat. They'll starve to death. And almost always, traditionally, now there are picky eaters, and we are
Yeah.
very careful in the way that we introduce and monitor the intake and change the diet.
Mhm.
But almost always, within 3 to 4 weeks of removing those white diet foods, their diet just explodes. It just opens up. All of a sudden, they're eating broccoli, and the parents are like, "Oh my God, they would
Wow.
never
Yeah.
touch that," And it's because we've removed that addictive response to the gluten and casein. But for some kids, we have to go super slow. I mean, you take the
Right.
same milk carton, you start to take your alternative milk, you take like, a 16th of the
Slowly,
carton,
slowly.
and then you slowly increase your ratios and you never change that carton. It's the same carton all day long, and then it takes you 3 or 4 months until that same carton now has coconut milk in it instead of having,
Well,
cow's milk in
our autistic kids are highly sensitive and
it.
aware
Exactly.
and have really good taste and smell, so they can pick up on those little changes. Okay, so let's
Exactly.
go back up your level to that nutritional. Are there some good kind of in other words, what's the best way in terms of nutritional supplementation? A lot of kids need nutritional supplementation, actually. There's not many kids that eat the full range of foods that they need to be really
Mhm.
healthy given the environment and given the way we live today. So let's talk about that nutritional supplementation piece.
So, I mean, we in our again at one of we have all these sayings in our clinic, right? And one of them is test, don't guess.
Mhm.
And so your regular insurance, whether it's Medicaid, Medicare, your regular insurance program,
Uh-huh.
usually covers basic nutrient testing,
Okay,
and
that's good
so
to know.
it's not like an extra expense, and you should be able to go to your pediatrician and say, hey, I'm really concerned, my child's a very picky eater, could you please run a basic nutrient panel? I will tell you that what we see in clinic a lot, we see vitamin D deficiencies,
Yeah.
we see, B12 and folate deficiencies,
Mhm.
we see zinc deficiencies a lot in clinic. Sometimes we'll see some magnesium deficiencies or copper deficiencies, but the big ones are vitamin D, zinc, folate. The other one is actually very low cholesterol.
Huh.
Because the fatty acid processing is not there, the digestion to break down those fats is not there. And cholesterol is very important for our bodies. It actually forms some of that lipid raft in cell membranes. It's important to the lining of our gut, to our brain blood barrier, and it's actually the precursor, the hormonal precursor of testosterone. Their cholesterol is 90 or 100, and then you wonder why, why they're sluggish, why they're not, they don't have energy, they're not, sort of feeling very well or healthy. And so those are some of the common things that we see and can correct. Now, there are a few sort of multis out there for designed specifically for autism. by and large, the doses that we use to correct deficiencies are very high compared to
compared
whatever
to
you'll
like a
find in a
regular
multi.
multivitamin.
Yes. And what we tell people is if you look at a regular multivitamin, because a lot of people will come and say, oh my God, I've got a handful of 20 pills. Well, if you look at your regular multivitamin, you've got 40 ingredients there, you know, and you're
Don't
getting
want
sub,
20
yeah,
times the dose of
yeah,
both of those things. Yeah.
yes, you're getting subtherapeutic doses, and they're not individualized to you. We're sort of designing your individual multivitamin, and we do have some compounders that can put some
Right.
things together and all of that. But I will say that the ARNC has probably the most decent sort of basic multi. The That's James Adams' clinic. He has a really decent like multi vitamin for people with autism that sort of hit those
It's a
key
specific. Yeah.
deficiencies. Yeah, specific deficiencies, and it has a little bit more of the RDI, but you really cannot get as much as you need, which is why you need to identify your specific targets, because you don't want to take huge doses of everything, right? Like if you check your B12 and your B12's fine, then you don't need to take more B12. You just
Right.
need to take the doses of the things that are individual to you. So that's basically for those nutrient deficiencies. I would say get a lab slip, go get some blood drawn, have a
Yeah.
look and see, what's there. And you will improve that by improving your diet. By eating whole foods, you're going to have more nutrient value in those whole foods. If you decrease the inflammation in your gut, then you're going to have more of that nutrient absorption, and then you're going to have less likely to have those deficiencies.
That makes perfect sense. Okay, so now I'm going to ask you the tricky question. Folic acid and folate during pregnancy. Would you say don't do it? Go ahead and do it. Be aware of it. If you have autism in your family, avoid it. Like what? And I know this
I
again, this
would
is
say
kind of your
absolute.
opinion.
Right. My opinion, absolutely do it. I mean, again, we're all trying to be healthy and have the healthiest pregnancies that are possible. Just be aware. You can again look at your own methylation status. You can even from the 23andMe's and stuff. You can get like your
Yeah,
several of your SNPs, and we can talk sometime about the difference between a SNP and a mutation. But you can
not today.
see. Not today, right? But you can see, if you have that predisposition, and just be aware of the fact that you're probably, you may need to have that as part of a healthy diet or supplementation for your children moving forward. I'll tell you, I have 4 kids, and when my youngest was born, she was a late in life little oops baby, and when she was born, we had her, testing almost from birth while we were still in the hospital. We were running different statuses. She's been on, B12 and folate supplementation from the time that she was born, because we knew that we had these immune system issues and methylation defects that run in our family. And she's been, the most stable a kid health wise in our family, because we were able to act proactively. So
Right.
absolutely. Now, you don't want to take regular folic acid. Regular folic acid actually does not metabolize well in your body. And if you have certain mutations, it actually causes problems. So you want to take methylfolate. You want to take the form that your body actually uses. And there's a growing push. Most people know that now, and,
Most
and
of
they're
the
actually.
prenatal vitamins have the
Yes, they
methylfolate.
have the methylfolate. Even the Smarty Pens now for kids has methylfolate in it. Like a lot of that old cheap synthetic folic acid is getting pushed out by to the wayside by the real stuff that our body uses. The
Well, that's
actually,
good.
yeah,
All right.
is
So now we have the next level, which is okay. Now we've got the immune system, makes you predisposed to like viral stuff. We see tons of Lyme disease. We see tons of we see Epstein Barr. So tell me about the trends there, because there's a lot of these kids who, they'll pick up a tick, they'll get, the bullet bullseye thing, and then they have this long, long, long fight with Lyme disease. Let's talk about that for just a minute.
so this is actually another one of our key points. It's not the pathogen; it's the
Right.
immune system.
Right, the
So
immune system is can't
yes,
can't deal with it.
right,
Right.
and you will trade. I call it whack-a-mole. Remember that old game that you would go
Yeah.
to at cheese and you'd whack the whack-a-moles?
Mhm.
If you have problems with your immune system, today it will be Lyme, tomorrow it'll be strep, and you'll have, pandas, post-infectious encephalopathy.
Candida. Yeah.
Yes, yeah, then it'll be candida. You'll just be doing whack-a-mole. And so it's not that we don't treat an active infection, because we do, but we
Yeah.
really have to understand the root of the problem is not the
It's
Lyme
yeah. is
know,
immune
there are people
function.
that
Yeah.
thousands of people that get bit by Lyme-bearing ticks every day, and they don't get sick in chronic Lyme because
Mhm.
their immune system neutralizes that bacteria, kills it right
Quick.
away, and goes
Yeah.
on. It's the people who have these immune deficits that are
Mhm.
having this problem. And I will tell you, just as a little caveat, that since COVID's immune suppression is playing a big role in also bringing back more chronic pathogens and more recurrent illness because of the way that virus interacts with our immune system. And so when you're talking about, protecting yourself and making sure that the immune system is working optimally, obviously, again, we go back to the diet plays into it, getting
Right.
rid of that inflammation. Your mitochondrial supports and the energy to be able to fuel the immune system plays into it.
Mhm.
And then there's just some things about, sort of being smart. If you know that you have chronic upper respiratory infections, then, maybe don't go to the Taylor Swift concert in the middle of December. Like sort of pick and choose, make your like smart
Pick your
choices,
assault, right? Pick your assault.
Exactly. There is actually a really cool new nasal spray that's
Uh-huh.
made out of pectin and gelin that's decreasing respiratory infections. It actually
Oh,
traps and so that's one option.
mhm.
There've been actually since post COVID, there've been a lot of different nasal sprays, and that's one thing that people can do that's a little bit less invasive. It's not not as onerous, and it lasts for about 8 hours. So that's something we recommend to our immunocompromised population. It's called Profi. You can get it online. So like there's little things like that, picking and choosing your times and your what's important in your events and how you time them. Using something prophylactically like Profi, making sure that your nutrients, your immune system isn't run down. And then there
Yeah.
are like immune boosting supplements too,
Yeah.
that again can be individualized according to your own immune profile. If
Right.
you're always getting viral things, you can try like lauricidin, which is like a coconut oil derivative, or you can use astragalus. Like there's other things like that you can do to help support your immune system, especially if you do need to go to the DMV in the middle of cold and flu season, or wherever else it is, or
Yeah.
I mean,
Yeah.
again, school's a real issue, right? Schools are little petri
Yeah.
dishes, and so we just have to do the best that we can to try to avoid those inflammatory responses. And if one good thing has come out of the pandemic, it's a better awareness of how cleaning the air is important. If you have kids, for example, we have a lot of kids that get really triggered in the spring by the pollen and the
Right.
respiratory allergies. And just running an air filter in their bedroom will reduce their pollen count, especially when you're asleep. You're supposed to be resting and healing. You're not supposed to be breathing in a bunch of pollen that's going to inflame your immune system, right? And so something as simple as getting, an air purifier with a HEPA filter in it and putting it in their bedroom so when they sleep at night, they're not having that constant, immune triggering by the pollen is really helpful to some individuals. So even little things like that can make a big difference in terms of immune activation.
Mhm. All right. And I know I'm opposite on your graph, but talk about the autoimmune because we do. And by the way, we see this in especially as individuals on the autism spectrum get a little bit older. They start picking up the autoimmune conditions, and by the time they're 30, 40, they've got three, four, five different that's seemingly unrelated idiopathic autoimmune conditions. Right? Talk about
Mhm.
that for just a minute.
Okay. Well, and I don't want to get way into the weeds because I can, but again, when we go back and we talk about the energy balance in your body, and the immune system being that second biggest energy user of our body, it is super common. I would say almost always we would see there's an immune deficiency and an immune overactivation because the energy is going from one spot to the other. Either
Right.
the mitochondrial, the ATP is getting shunted over into an inflammatory response and the immune system is attacking the person's own organs, and then that leaves them deficient, and it's not fighting off viruses, it's not fighting off pathogens, or vice versa. Maybe we're doing a pretty good job of fighting off the viruses and the pathogens, but then we're not producing those anti-inflammatory
Yeah.
chemicals that turn off that inflammatory inflammatory response in our bodies. And that lack of immune balance is just something that it's one of the comorbidities that happens in people on the spectrum. There's something called the mTOR pathway, which, like I said, we won't get into, but there's lots of studies, if you look them up, about the mTOR pathway in autism and how the signaling in that pathway is aberrant, and it causes autoinflammatory conditions, and some of those express as autoimmunity, other of those express as autoinflammatory. And the
Right.
difference in autoimmune and autoinflammatory is autoimmune has an antibody associated to it. Autoinflammatory is just a signaling chemical like a cytokine or something that calls for the mast cell disorders, those kind of things that call for inflammation that's not antibody mediated. And so that's all part of bringing everything back into balance. Definitely, like you said, the older individuals that have accumulated, or like my son, who's accumulated, six
Half
or
a
seven
dozen.
autoimmune
Yeah.
conditions. Yeah, I mean, he's on an immune suppressant at the same time that he's on mitochondrial support and other things, to help his body fight off pathogens. So you want to try to achieve that balance, and
Right.
that's what we do. There's something called a lymphocyte panel. Again, it's covered by your regular insurance. It looks at your T cells, your B cells, your natural killer cells.
Yeah.
You can see which parts of it are lacking and which parts of it are overactivated, and
Interactive.
you
Yeah.
can choose a therapy that, say, if it's your B cells, there are therapies that just work on the B cells. If it's mTOR, there are inhibitors of mTOR. If it's a natural killer cell, there are things we can do to stimulate natural killer cells if you need more of them to help as your first line to fight off viruses. So again, that's where that sort of personalized data comes in. As we look through the different parts of the immune system, we can start to see where are the deficiencies, where is the overactivity, and then what do we need to do for that individual to bring it back into balance. And so it's boosting some of it and it's calming some of the other pieces of it down.
Yeah. Well, we've done a really great job of talking about how all of this fits together and how really the physiology of autism contributes so much to the challenges that individuals across the autism spectrum have. And we talk about these kids, adults, it doesn't matter what age they are, healthy. We still want to be healthy, right? And it's harder to be healthy with autism because there's so many different variables at play here. But I think, you've done a really nice job putting those pieces together for us. And we are kind of we're winding up on our time here. So as we're closing out our session, I'd like you to maybe think for me how you would kind of summarize if someone didn't see this whole session and they saw maybe just the last, I don't know, 5 minutes here. What would be those takeaway points? What would be those kind of two, three, four things that you think are kind of the high points of this session that you'd like to kind of summarize and wrap up with today?
Sure. So first of all, everybody deserves access to care and standard of care treatment for their conditions. So don't accept any medical provider that tells you, well, you have this abnormality, but it's just because you have autism. Sometimes they call them insignificant abnormalities, which is a real oxymoron, right? If it's an abnormality, it's probably significant. That's where the way reference ranges
Especially if
sort of
it
work.
makes you feel terrible.
Exactly, especially if it makes you feel terrible. So, number one, use that, keep that in the back of your mind. Use that tool. What would you do, for me if I didn't have autism, or what would you do for my child if they didn't have an autism diagnosis? And
Yeah.
hold providers to that standard of care.
Mhm.
Just because a person has autism doesn't mean they shouldn't have access to all of the medical treatments that a neurotypical person should have. The second thing that I would say is just be aware of all these comorbidities. This might be the first time that you've heard that 30 to 40%
All
of
these
people with autism
pieces, right? Yeah.
have abnormal EEG activity, and you may never have had an EEG, or your child may have never had an EEG. You may have never been tested for certain antibodies or autoimmunity. This may be new news. Autism is not synonymous in our society or culture with some of these medical conditions, and it really should be. I mean, we really should have a standard standard diagnostic algorithm for people with autism. So make sure that no abnormal findings are dismissed, and then make sure you're looking at these medical comorbidities. Educate yourself and start going in and asking those questions of your healthcare providers, whether it's Lighthouse or somewhere else. Go to your pediatrician and say, hey, would you check basic nutrients for my child? They're super picky and they have, these gastrointestinal issues. And I really want to know, do they have, adequate iron stores? That's another one we didn't mention.
Yeah.
Low ferritin is very common in our clinics. And so those would be the two biggest takeaways. The third thing would also be, that these things are treatable. There are ways to get to wellness and improve all these things that hold us back. Though, those of us with autism who can't, participate in the things that we want to do because we don't feel good, because our head hurts or our tummy hurts,
Or
or,
can't think clearly, or can't perform executive functioning tasks, or
exactly.
I can't
Yeah,
retain information. Yeah.
exactly. Cognitively, we only improve when we come to wellness. So don't just say, oh well, I have autism, so I'm consigned to these medical abnormalities.
Hmm.
Take hope in the fact that the majority of them are treatable, and even if they don't go away, they can get better, and every little thing adds up. It's cumulative, right? Every little step we take towards wellness, and before you know it, we're way farther than we ever thought we would be, and we feel way better, and we function
Yeah.
a lot more happily. So,
Right. And I'll add to that that first of all, and by the way, I'm assuming you guys don't just treat autism, you treat all people, right?
correct.
Okay. So I would say that two things. One, that this is a process that we could all learn from in terms of improving our own physical health, which gives us the energy to support our kids and support the individuals with autism in our lives a little bit better. But there's also another piece. I think for parents who this is brand new, it looks like a lot. It's like, oh my gosh, there's this whole pyramid and there's like 95 things I have to be. It's a process. This is not a sprint. This is a lifelong journey. And that to take these pieces just little bites at a time. You don't have to jump in and do everything now. Pick an area, figure out where you might be on this pyramid and pick a couple things that you want to address with your pediatrician. And I would also say if you've got a pediatrician who won't work with you, get a different pediatrician. But
Right,
yes,
exactly.
knowing that it doesn't have to overwhelm you. It can be a little process. I will kind of close out this session by saying that I had a very serious health crisis in my life. Started with a traumatic brain injury that ended in a dozen psychotropic type medications to treat that. That's then resulted in a seizure disorder that then resulted in GI issues. And pretty soon I was, had three autoimmune conditions and had asthma and was, then I was being treated as with immune suppressors and kind of got myself down into this really, really deep hole where I was covered in hives for like 4.5 years, all over
Wow.
90% of my body with autoimmune idiopathic urticaria hives. And so the process to get out of that was a process. It's something that took years, but just taking these little tiny steps, these little pieces really helped a lot in that journey, and being able to have the guidelines that you guys have laid out and that other um, biomedical and functional and integrated medicines physicians have put forth. There are good physicians out there. There are good people out there
Mhm.
who have worked through kind of this holistic health model with not only individuals with autism, but people with serious health crises.
Right,
And
and you
there's a
don't want
process.
to. You
Yeah,
don't want to do everything at once because
you
you have to
can't.
keep in mind there's an order.
Right.
And
And
so you just start at the beginning and you go one step at a time, baby
right.
step by baby step. Don't try to do it all at once. It's absolutely spectacular advice because you may end up doing something that you're not even ready for yet, and so it may not work
Exactly.
until you
Yep,
get into the
exactly.
right space.
Yeah, exactly. And it's tricky because there are times when, like you talk about, well, the speech therapy is way up here. So there may be times when we are doing some of those therapies and some of those educational supports while we're building, because it might take 5 years to build the system up, right? So we can't just like hold off on education. So there is kind of a top
Right.
up and bottom, top down and bottom up process here. But knowing that, just take it in small, manageable bites. And that's one thing I can tell you, having covered with my own health crises, it's just those little tiny changes. And it's like thinking about, okay, so what one thing could I change this week? Well, this one or this month or this year, maybe we
Mhm.
just get rid of, sugar. Let's start
Right.
there.
Right. Exactly.
So yeah,
Exactly.
anyway, but yeah, I really appreciate your time with us today. It's been a true pleasure. And I think, and I've heard a lot of this stuff through the years and have been on this journey for myself, but I don't think I've ever heard it so clearly and succinctly laid out. So
Well, thank you.
thank
I
you
consider
so
that a
much.
high compliment, and I'm happy to be here and share.
Yeah, I really appreciate it. And I really appreciate your diagram because I think it helps us see those stepping stones on our way up to better wellness. So thank you so much. And thank you to all of you that you have taken the time to watch this session. We appreciate you being with us at the US Autism Association. And we'll look forward to hearing more from Kara in the future. Have a great day, everybody. Thanks.